Recording in progress.
Medica is a country. Good evening, everybody. Meeting after a week with the Boericke Materia Medica. A very warm welcome from the Divine School of Homoeopathy to all of you who have joined. Today again, we will have a good discussion regarding the Boericke Materia Medica aspect, which I used to use while utilizing Boericke Materia Medica. And that's why the things which I know, I want to share. The things I utilize this in my practice, I want to share, because logic is very much necessary to be shared, which is not done in homeopathy generally. And that's what I feel every time. And this is the reason why Divine School of Homoeopathy is there. Divine School of Homeopathy never teaches anything like just a copy paste, but it is something which is very essential, how to think logically and how to understand everything. Unless and until we understand the things, it is not possible to get the things clear in our mind. And that's why for this today's Thursday session, a very warm welcome to all of you in this very special session. We'll go ahead directly with our topic, understanding the Boericke Materia Medica. First of all, we'll start directly with the case. Very simple case, acute case. And the way I used to think in acutes, what is the essential or what is the essence of the case? That's what you have to catch. I know you might get the remedy very easily because many of you are practicing homeopathy. You understand it, you grasp it. But I don't want to teach that only. I want to teach something which is related with that remedy, which is also important aspect, and we generally miss. Being a homeopath, we never give so much of importance to certain things, and that's what I want to share with all of you. So let us start with the case. Case is very simple, that's all. A 30 years female, my regular patient, came with fever 5 days back with severe pain in small joints of the hands and feet. So that was the fever with chill 5 days back, just a recent case with severe pain in small joints of hands and feet. She said that she had a very severe chill at around 3 to 4 a.m. consecutively on 2 days, followed by fever and sweating. Her eyes were completely red. She thought that it will settle on by itself and never took any medicine on day 1. But since morning, I have headache, bitemporal, but now she is having, it is only on left-sided supraorbital throbbing headache. She said, I'm feeling too weak after this attack. And that's why I'm here in front of you. And she was looking a little bit toxic, a little bit weak, very exhausted. And that's all. That is what the patient has told. This is the case, nothing more than that. Because all parameters are related. Now, after the sweating, she doesn't have a temperature when she came, but she have severe weakness and red eyes. That's all. And she was looking toxic. Yes, she might have something which is very important and which should be treated. Many times you never get all the details of the case. You have to think logically in such types of cases. Logic is very important entity which you have to utilize when you deal with such types of cases. So what might be the problem when patient complains that chill followed by a fever, followed by sweating, all those things happens to be there? It is a type of intermittent fever because patient is in front of you and now doesn't have a temperature. But she had it consecutively on the 2 days and at the same time. I was knowing the remedy because in Kent's repertory, when I have studied Kent's repertory, the chill chapter, I was knowing that chill at 4 a.m. followed by sweating, single remedy mentioned in Kent's repertory, and that is Cedron. I was knowing that, but I want to confirm whether what complete repertory says, because patient has not given specific 4 a.m. It is between around 3 to 4 a.m. This is what the patient has said. So I opened the complete repertory and I saw the rubrics. And this was the repertorization. Chill midnight after 3 a.m. and Cedron is mentioned under 3 a.m. Again, under the 4 a.m., the Cedron is mentioned. And midnight after 4 a.m., perspiration before, chill before perspiration, again, a Cedron single remedy is mentioned. So, remedy was very clear in my mind that Cedron is the remedy. Just give the Cedron. That's very simple. Yes, giving the Cedron is very simple, but to understand the Cedron is very important. What has happened? I have given the Cedron to the patient. Cedron 200, 3 doses consecutively every 15 minutes, and asked her to return next day. Next day when she returned, I asked whether you have attack, and she said there was no attack today morning, and still today I am not having the fever. And comparatively, her redness of eyes was reduced. She was quite comfortable than the earlier day. Again, I asked her to visit me next day. I have not given anything. I have just continued with her the biocombination 11. That's what going on. That's what was the treatment. Next day, again she returned. And again, she never had attack. So this is too important that Cedron, if having very specific modality, it is the remedy which works in intermittent fever, malarial fever. And I have confirmed it many times. This modality, 4 a.m. modality, is a very confirmatory symptom, which I have confirmed many times in my practice. So it was wonderful result after Cedron, and patient was settled. But why not to share a Cedron with all of you? That's what I thought. Because we know Cedron as a remedy for intermittent fever, that is what there in our mind. And we used to consider that is the only one aspect of Cedron. But I want to show you something which is very essential and which we generally miss in Cedron. So I will going to share with you only the things which are mentioned over there in the Cedron from Boericke's Materia Medica. It is a rattlesnake bean, Simaruba ferruginea. This is the common name. First sentence is very important. The periodicity is the most marked characteristic of this drug. This is the sentence, the first sentence of the Cedron. The question arises in our mind, the periodicity, another remedy which is there in our mind is the Cinchona or China. So second remedy which is there in our mind, the China. But what is the difference between the China periodicity and the Cedron periodicity? This is very important. Cedron periodicity is the clock periodicity. If it happens 3 o'clock in the morning, next day it will occur at the same time, 3 o'clock. Clockwise periodicity comes under the Cedron, and it is not related only with the chill. It is related with every aspect. If it is a headache, it recurs at the same hour. The hour is very important. It is not a calendar periodicity, which is there in Cinchona bark. Cinchona bark is the remedy where there is every 8 days there is a fever, or every 4 days there is a fever, every month there is a fever, or every yearly there is a problem. It is a calendar periodicity which you used to get with the Cinchona bark. And Cinchona is very, very specifically mentioned for that. When you think about the Cedron, it is the clock periodicity. And this one must understand, and not at all related only with the fever or with the chill. It is related with the many aspects. Whatever may be the complaints, whether it is related with the rheumatism, the attack will come again on the same time. If it is related with the colic, it will happen at the same time on that day. And that periodicity which you can get with the Cedron. Second important sentence which was there, it's particularly useful in tropical or in damp, warm, marshy countries. Yes, damp, warm, marshy countries where there is a malaria is very prominent. Malaria used to happen very commonly in those areas. Intermittent fever is very common. Intermittent fever and its complications are quite common in tropical countries and damp warship countries. Cinchona and Cedron, these are very, very, very important remedies in such areas. It has been found curative in malarial affections, especially the neuralgia. See, very important feature. Cedron is not only having the action only on the fever, but it has a neuralgia. It acts on the nerves. It acts on the nerves. That's why it is very useful remedy even in snake poisons. It has been mentioned directly. It used locally for the snake poisons, anti-venom. It has been given over there. Adapted to the purpose of voluptuous disposition. What is voluptuous disposition? They react so instantaneously, very irritating, very excitable, nervous temperament. Whenever the word nervous comes, it is on the tip of their nerves. Nervous is always related with the nervous system, not with the nervous which you used to use in our Marathi. It is not that nervous. Here it is on the tip of nerves. They are very active, very sensitive, very fast to react, quick to act. Cedron is like that. These people are of a voluptuous disposition. They get irritated very easily and they are excited, impatient. This is the reaction of Cedron, and that's why Cedron is a remedy in acute states. Acute chill, acute rigor, acute headache, acute supraorbital neuralgia, acute rheumatism. This is very important with a periodicity. This is too important to know. So one must always understand all those things. Every word is important. The sentence which is there has powers of antidoting snake bites. This is very important thing, but it is in material doses, not in dynamic doses. Dynamic doses, it has been mentioned that if you use it directly on the wherever the bite is there, it has anti-snake properties. And that's why it is a very useful remedy in material form to be used at the local site, this Cedron, and even for the stings of insect bites or insects like Apis mellifica. So this is very important. Another feature one should not forget regarding the Cedron. Tincture of pure bean scraped on wound. This is what Boericke mentioned, and it has been confirmed by even by Murphy. He has mentioned the same thing in his Materia Medica or in his keynotes. He mentioned the same thing. Then it is a remedy for mania. Mania is the madness. That madness is an immediate reaction, the voluptuous reaction, excitable reaction, a nervous reaction. And that's why this person goes directly into the state of mania. Even they suffers from the fever attack or chill attack, they goes into the mania, disturbed so violently. So this is the first paragraph of the Boericke, and I always suggest that read always the first paragraph of Boericke by heart. Understand the core of the remedy. This is the core of the remedy, which defines, yes, this is Cedron, nothing else. But this is not only the thing with the Cedron. We'll go ahead and understand the Cedron further. First, it has been mentioned the head symptoms of the Cedron. What has been mentioned under the head? There is pain from temple to temple. Patient always comes, doctor, headache is there from temple to temple. This is very important. Across the eyes, it runs like this. Pain over the whole right side of the face. Coming on about 9 a.m. Again, a clock modality. Headache specifically on the right side of face, coming on about 9 a.m. Very specific. Then he mentioned the crazy feeling from pain across forehead, worse by working on black. So in the dark, whenever you work, it is to create a problem. Roaring in ears produced by cinchona. Whole body seems numb. Roaring in ears produced by cinchona means it is cinchona if it has been used, the quinine derivatives. Patient usually used to take the quinine, chloroquine phosphate. That is one of the side effects of chloroquine phosphate. It either produces the diplopia or it produces the oversensitivity in the ears, roaring, a sound sensation in the ears. That is the chloroquine phosphate's side effects are there. And those, if patient has consumed chloroquine, that that thing, it has been mentioned over there. Whole body seems numb with the headache. That is another feature. The patient tells you directly, doctor, a whole body I feel numb. I feel badhir dala sarka vattade. It becomes very, very, very numb. And that is associated with the headache. So whole body numbness associated with the headache is another characteristic one should not forget about the Cedron. So see, these are the very important things one must understand. Whenever a patient of a viral intermittent fever comes, who presents like this, and many a times patient presents all those things. Then see the eye complaints. Eye complaint, the shooting over the left eye. Generally, our thought is always runs behind the spigalia. But in spigalia, it is more of a neuralgic origin. In spigalia, it is associated with heart complaints. It is a palpitation. With spigalia, it starts from occiput and settles over the left eye. That is very typical with the spigalia. It is supraorbital in cases of the Cedron. It is orbital, supraorbital. The eye gets painful and it is shooting inside the eye. It is because of two important things which are mentioned over here. There is the iritis and choroiditis. These are two important pathologies which are very, very important in Cedron, because of which pain is there. So severe pain in eyeball with radiating pains around the eye, shooting into the nose, scalding lacrimation. The lacrimation is there and it is burning. It is from left eye only, one-sided, and red eye becomes completely red. Supraorbital periodic neuralgia. See, supraorbital neuralgia, which is of a periodic origin. Here again the periodicity comes. Here again the time modality comes. And two important words which we miss and we never understand, iritis and choroiditis. What happens? We generally miss what is iritis, because we never give so much of importance to these branches of the medicine, which are branches of the surgery, which we generally overlook and we never study. What do you mean by iritis? Let us see what is iritis. Iritis is the swelling and irritation, inflammation in the colored ring around your eyes pupils. That is around the iris, the ring which is seen around the cornea. That is what is the iris. Another name for iritis is anterior uveitis. This is very important. Anterior chamber uveitis is nothing but the iritis. If it is a posterior chamber uveitis, it is called as choroiditis. Uvea is the middle layer of the eye between the retina and the white part of the eye. This is the middle segment between the white part of the eye and the retina on the backside, and in between area which is called to be uvea. And this, if it is on the anterior side, the inflammation is there. It is generally labeled as the iriditis or iritis. Iritis can lead to serious problems. It can cause severe vision loss and even sometimes blindness. See, we have Cedron, very specific remedy, and whenever the patient complains of single eye, all of a sudden have a very severe pain, shooting pains, and there is a complete redness. Think of iritis or choroiditis. And because these complications one should not miss, otherwise patient can become blind. You must think about it. And for that purpose, it is too much necessary to learn all the clinical conditions. I have worked with Dr. Nitin Bagli and his Madam Bagli Madam. She is a very good ophthalmologist and ophthalmic surgeon. I worked nearly about 2 years with them, and I have seen all those things in that hospital. Even I got the chance to treat the glaucoma over there with homeopathy. I have got the chance to treat the retinal detachment with the homeopathy, because the patients were admitted over there and she has given me a chance. Prasad, use your homeopathy. This is very important. This is what one has to understand. If you are able to understand all those things, then you can treat them, and then you can understand the remedy with a better perspective. Anterior uveitis or iritis is an inflammation of anterior chamber and the iris. Uveitis is often idiopathic, but it may be triggered by genetic, immune, traumatic, or infectious mechanism. 4 important things: either genetical, it may be because of immune reactions, autoimmunity, It may be because of trauma, or it may be having an infectious origin. The symptoms include redness and sensitivity to light and pain. And this is very important thing one should not forget. This remedy is a wonderful remedy for that purpose. So what happens? We fixed our remedies: Cedron, fever, intermittent fever, malaria, that's all. It is not like that. This remedy is having very, very important feature regarding the iritis and choroiditis. Causes of iritis include injury to the eye, blunt force trauma, a penetrating injury, or a burn from a chemical or fire can cause acute iritis. So at least this much one must know what is iritis. So when a patient comes to you all of a sudden with a shooting pain in the eye, with a redness of the eyes, he is not able to look towards the light, he is very sensitive to light, think of this diagnosis in your mind. And if you think this diagnosis in your mind, if it is related with the left eye more commonly, think about the Cedron. If there is a periodicity, it is definitely a Cedron. See, this is how one has to look towards the pathology. Second is the choroiditis. It is also called as chorioretinitis, is a type of posterior uveitis. The choroid is the vascular layer of the eye, which lies between the retina and sclera. Since the choroid is responsible for the vascular support of the outer layers of the retina, inflammation of these layers can lead to vision-threatening complications. Both the iritis and iridochoroiditis, both are always a complication-producing pathology. And that's why one must able to diagnose those. One must able to understand those. And that's why one should not miss all those things. When you are reading the Materia Medica, read this. Understand this. If you don't know the name, open the dictionaries. Find it out what exactly it is. Understand them. Understand the severity of them. So that if you are not able to treat with your homeopathy, or if you are not able, you have a confidence, at least refer that patient to a specialist so that he can diagnose. And if he diagnoses and you get the diagnosis, think about the again homeopathy for those cases. But with this practice, you get better confirmed with your remedies. So these are two entities. Chorioretinitis may be caused by infection or autoimmune diseases. It is sometimes caused by an infection that you had when you were young, although the symptoms may not appear for 10 to 20 years. So it remains, the infection remains in the eye for longer time of duration, and sometimes some exciting factor happens and then it reflects back. Complications of chorioretinitis or choroiditis are very important. During the acute phase, choroidal neovascularization may occur, which is the most severe complication of the disease because it produces completely blindness. Cystoid macular edema also develops in 14 to 41% of affected eyes. Other complications include glaucoma. Yes, the increased intracranial pressure, increased intraocular pressure, glaucoma, optic nerve atrophy. See, very severe complication. Permanent blindness can be produced because of it. Macular atrophy, vitreitis, inflammation of vitreous, and progressive subretinal scars. All the complications are which are very difficult to recover. This is the problem with choroiditis. And that's why one must understand these two words are very important from this Cedron. And this remedy has that much of depth. It works at the neuralgic level, it works at the eyes level, in the iris as well as and the choroid that is producing choroiditis, and these are very essential, one should not forget, and because of which there is a supraorbital or orbital neuralgia is there. So it is eye pain which is related with this local pathology. In the extremities, yes, last part of it is extremities, the lancinating pain in the joints. Worse, feet and hands. Specifically, feet and hands, it is very, very severe lancinating. These are going up and on. Sudden pain in the ball of the right thumb, extending up arm to the shoulder. So it is right from here to whole shoulder, the pain runs. Pain in ball of right foot, extending to the knee. Shingles, very important thing. Shingles is nothing but the herpes zoster. Herpes zoster with radiating pains, herpetic neuralgia. It is one of the important remedy. Generally, we think about Rustox, and yes, definitely 90% of cases you can treat with the Rustox, but sometimes neuralgia persists. One should not forget about the Cedron. The other remedy which you can think about is the hypericum in post-herpetic neuralgia, but one should not forget this Cedron in such types of cases. And last point which he mentions about it is the dropsy of knee joint. So inflammation of the knee joint with the effusion. And generally, this is viral arthritis, or this arthritis is because of this intermittent fever and the complication of it. This dropsy develops over there. Last, nothing but important is fever. Chilliness toward the evening, then the frontal headache extending to the parietal region, red eyes, hit with itching of the eyes, tearing in the limbs, and numbness of the limbs. See, these are very important features. The chilliness extending towards the evening. Evening patient complaints, I used to get feverish sensation in the evening. Then headache starts. It is frontal across the temple to temple, across the eyes, extending to the parietal region. Red eyes, heat with itching of eyes itches, tearing in the limbs. The limbs, there is a severe tearing pain and numbness of the limbs. See, all the features associated with the fever are very important. And with a periodicity, a clockwise periodicity is always a Cedron. Remedy relationship, antidote is lachesis. Compare arsenic and China. Yes, both remedies are very important remedies for intermittent fever. Arsenic is the remedy where chronic malaria is present and having typical arsenic features. That means there is thirst for small quantities at frequent intervals. Patient is too chilly internally, but head is hot. Very typical arsenic features which you used to get over there in arsenic. And that's why very easy to differentiate arsenic and Cedron. China, already I have discussed, the China is the calendar periodicity, which is there. China periodicity everywhere like Cedron. Both are very close to each other, but China is a big entity. China is a very well proved remedy where you have whole picture of the China. China has very important GI features where there is a distension of abdomen, the flatulence which is there. The specific one important thing is that chill never comes at night is the characteristic of China. There is no chill at night, no rigors at night. That is China. So while comparing the China, it's too easy as compared to Cedron. So both remedies have different perspectives, even though they are mentioned on the intermittent fever. So that's all about the Cedron. And last, dose tincture to third attenuation is mentioned by Boericke. But my suggestion for this remedy is not the third attenuation or etc. I used to always use this remedy either in 30 or 200 potencies generally. 200 in frequent doses are sufficient. If you give at the perspiration during sweating time, no more second attack comes if it is the right remedy for the malaria. This is too important. It should not be given in the prior. During the chill stage, you should not give a remedy. In malaria, keep it in your mind. During the phase of a increasing fever after the chill, you should not give the remedy. Remedy should be given in malarial cases or intermittent phases. At the end, when the attack starts subsidizing or when attack ends, you should give the remedy. So that's all for today's session. Thank you very much being there. We are there always in order to teach as much as we can and as much as we know. The Divine School of Homoeopathy works for that. Be a member of our school. You can contact with us anytime. Dr. Pererna, she is always there, and you can contact her and always be a member, those who have not yet joined. Thank you very much for today's session. Are there any questions? We will have a chat for 5 minutes. Are there with us? anything if you want to discuss, we'll have 5 minutes. And thank you everyone who have joined today. Lot of people's, lot of even doctors, they have joined for today's session. Thank you being there every time.
Sir, can you brief on snake bites, because it is given as an antidote on snake bites? So what snake bites?
I have never used them. I have not got the case of snake bite directly to treat. So I don't have any experience. But it has been mentioned by many authors that it is a remedy for the snake bites for the local use. But I never got a chance, because these are the emergencies which generally in our consulting practice we never get directly. But those who used to work in specifically in the ICUs, they should use all those remedies and write down their whatever their experience is there. Keep a record of it, because that is very essential for the next generation.
Yes, sir. Hello.
Okay. Thank you, sir.
Thank you. Any other query? Any other question?
Yes, sir. I have a question, sir.
Yes, ask.
Yes, sir. As you said that Cedron has a periodicity. So how can we find periodicity in iritis and choroiditis?
Same patient, it is not fixed time. If it is patient complains that yes, I used to start getting pain 4 o'clock in the evening, next day also I used to get it on the 4 o'clock. It is not time specific for that, but same hours next day. It is time periodicity, which is very important over there. If there is a headache at 9 o'clock in the morning, next day also patient gets the 9 o'clock. So that is periodicity related with the complaints, eye pains, pain in head, pain in ears, or whatever it may be. It has a periodical headache or periodical complaints. So same hours next day, it is a periodicity.
And if a patient came especially with the problem of iritis and choroiditis, then we can use Cedron.
Why not? If all those things are present, if it is having a typical periodicity which is indicating the remedy, why don't you think? If it is very specifically left-sided, then it becomes more perfect. Definitely.
Thank you, sir.
Okay. So thank you everyone for being there. We'll meet again next Thursday, most probably, and we'll have different remedies in these sessions. Thank you, Pallavi. You are always there. Hello, Vaishu. Good evening.
Good evening, sir.
Yes. Hardik.
Hi, sir. Good evening.
Yes.
Sir, it remedy given in only on जब स्टेज पूरा होता है फीवर का तभी देना है ऐसा?
हाँ, फीवर का स्टेज खत्म होते, स्वेटिंग स्टेज जब आता है तब देने का. इंटरमिटेंट फीवर्स में always keep it in your mind. If you give it during chill, it aggravates the fever and sometimes it may produce complications. So it has been mentioned, if you go through the organ of medicine, Hahnemann has specifically mentioned how to use it. Intermittent fevers, he has mentioned doses and how to use it. He has mentioned over there it clearly.
Okay.
Sir, good evening, sir. Sir, if there is some dust particles or something in the eye, just like some foreign body, and it causes redness and swelling of the eyes, in that case, sir?
In that case, you have to remove the foreign body. That's all. That's simple. If it is because of foreign body, you have to remove the foreign body. Because if foreign body is there, it is your duty to remove it, because it is a maintaining cause and you have to remove it by any means. Okay, thank you very much. We'll meet next time. Thanks a lot and good night.